My cardiologist convinced me to come to this camp for a whole week. He said that he would be here and everything would be fine. I stayed, I went to one campfire, and after that I was hooked. I didn't want to leave.
I started at Heart Camp when I was 8 years old in 1991, the first year that it opened. I remember coming back every year. It's once a week, but it felt like you just still saw those people a week ago. Like, the friendships have really lasted forever. There's so many people from here that I still keep in touch with and talk with. And this was way before social media.
It was absolutely amazing to hear that there is a whole camp of kids that had similar problems or a heart problem, that I was going to be able to do rock climbing or field games at a level where everyone would be with me, because I wasn't able to do gym class in school, so I was never able to keep up with the other kids.
At Heart Camp, a kid can show up and not know anyone like him or her, or feel really alone. And one of the things that really hits me, and it really hit me last year, was each night we sing "Lean on Me." It's such a strong message. It's a good song, and it's just, if everyone's together and you have a group that you know that you can lean on, you know, the rest of the year, even though camp is only a couple days out of the year, the entire year it can be just made. The difference is ridiculous.
The kids here, at least for my daughter, learns most here at Heart Camp would be true friendship, and learning that if somebody has a disability or a condition, it doesn't change who they are. It's their inner person that the kids have really learned to appreciate and love.
This is a place where people with heart conditions can come and they can enjoy it, because it's an actual place where all these people all around the world that have heart problems can come and enjoy talking to each other.
This camp is something that you don't want to miss out on. If you're not already involved, you want to be involved.
My son, Bruce, had a heart transplant in 1989 at age 11. And Dr. Neches was one of the doctors that took care of him. And so when Dr. Neches started this heart camp, Bruce was one of the original campers. Bruce stuck with heart camp, came back every year, worked his way up through a junior counselor, and ended up, when he passed away 2 years ago, he was on staff. And he still said this was the happiest place for him. He liked coming here better than he liked going to Disney.
It's a wonderful, wonderful thing that we've done here. And it's thanks to people like the American Heart Association and all the groups that come out for them, and the Children's Hospital and UPMC, and just all the groups that continually give and give and give, so that we can continue to offer this opportunity for the children.
And just a small amount of money to give a cup of coffee to a family, or that parent who's in the waiting room and things like that, or donating to be a part of this, to, you know, help campers only pay a small fee to experience this and have a normal experience for all of these kids.
It's made me a better person. It's made me more outgoing, and it's helped me connect to people who are like me. Because when I was younger, I was really scared to share my story with people, but as I've grown older, I've become more involved with telling people about my story and doing things to raise awareness for heart disease, because a lot of people don't understand that kids can have heart disease too. They think that it only affects adults.
Heart Camp is a really, really magical place. I think it really does change lives. The kids come here and they learn that they can be strong, and they learn that they're not alone. And it's just like, I can't say the word family enough. We are always here for each other, even the ones, I have friends that live 2 hours away, and I know that if I'm having surgery and I'm scared, or if I think that something's going wrong and I'm scared, I can call them and they'll talk me through it. They'll share their stories. There's just so much support here. And it's really, what Dr. Neches and Keith have done here is absolutely amazing, and I don't think that, it's just, I can't say family enough. It's really just a big family.